Hello and welcome to another Royal Reviewer live channel episode, and again I am live, so I will be answering as many viewer comments and questions as I possibly can. I am coming at you on the 23rd of February 2021, and we do have an update finally on Prince Philip, the Duke of Edinburgh's health. We have an official Buckingham Palace statement. I have kind of been waiting a few days since I last spoke about this because I wanted to come at you with something substantial actually from the palace. So what I kind of want to do to start off with is go through the timeline of events, and then I will read the announcement, the statement from the palace regarding Prince Philip's health. So, as I said, today is the 23rd of February. We got news that Prince Philip had been admitted to hospital on the 16th of February, a little over a week ago. We had an official statement that was released confirming that he had been hospitalised, that he had walked in there unaided, and that he was being kept there for, at the time, a few days. This is what we were expecting, a few days, just because of precautionary measures. We had no idea what the condition was at all. Buckingham Palace did not comment further. Then on the 27th, Prince Charles visited. He took the 200-mile round trip journey from Highgrove. His visit was said to have lasted about 30 minutes, where obviously he would have spoke to his father. I did make a video on that saying all the whys and what fors about the legality of a visit during the pandemic. Prince Charles was perfectly legal to be able to visit his father. Do go and check out that video where I provide links and evidence to support that. So the visit lasted for around about 30 minutes. At the time, it was suggested that Prince Charles had gone back to Clarence House, but later kind of reports have said that he actually went straight back to Highgrove. So not that he stayed in London, but just that he went back to Camilla at Highgrove. Then on the 22nd, which was yesterday, Prince William kind of was asked by Arthur Edwards, a royal photographer, about his grandfather, and Prince William said that his grandfather was okay. The audio on it is really kind of not particularly good on the clip that's circulating. I did kind of get the question, and I did kind of get that Prince William said okay. Some people are saying that Prince William gave a wink. I didn't see a wink, but anyway, I think basically Prince William was saying that his grandfather was okay. But at that point, we still had no official statement. Then today, we have had the statement. But before then, we had Prince Edward, who was asked by Rhiannon Mills of, I think she is Sky TV, what about the health of his father. And let me just go and I'm going to try and read his actual comments. So the Earl of Wessex, Prince Edward, responded, as far as I'm aware, well, I did speak to them the other day, so he's a lot better. Thank you very much indeed. And he's looking forward to getting out, which is the most positive thing. Asked about whether Philip was frustrated to be in hospital, Edward laughed and replied, just a bit. I think that gets to all of us, and then you can only watch the clock so many times and the walls are only so interesting. We've had some brilliant and lovely messages from all sorts of people, and we really appreciate that, and so does he. I've been passing them on. It's fantastic. Thank you. So, a little bit of kind of inside information from Prince Edward, basically kind of saying that, you know, perhaps Philip is a little bit frustrated about still being in hospital. We know the Duke's nature. Even at age 99, close to 100, he likes to be doing things. He likes to be doing whatever he is able to do. And probably being stuck in hospital, again, looking at those four walls, is probably not the most entertaining for a man that likes to be out there doing things. Of course, you know, he still drives on the estate, so we are led to believe. Again, he doesn't drive on the public roads, but, you know, just as much as a couple of years ago, he was still driving on the estates. He still goes for walks and all the rest of it. So I imagine that he is kind of itching to get out there. Right, I think it's time that we actually read the official statement from Buckingham Palace. So, this statement was revealed today, Tuesday the 23rd of February, and it says, the Duke of Edinburgh remains at King Edward VII Hospital, where he is receiving medical attention for an infection. An infection. He is comfortable and responding to treatment, but is not expected to leave hospital for several days. So, the couple of days that we thought was going to be the case has turned into probably more than likely to be up round about 2 weeks by the time it's probably all done. It's an infection. So obviously they haven't revealed what sort of infection it is. It could be potentially to do with some other pre-existing condition. We know that the Duke has had bladder conditions. So a lot of people's minds are immediately jumping to, was it a water infection? Is it something to do with the bladder? It could be something completely unrelated to a pre-existing condition. We do not know. So I'm just going to put it out there just to kind of stop any speculation. We don't actually know what the infection is. The only thing we know is he has an infection. The key word is he's comfortable and responding to treatment. I think we would be a lot more concerned for his health if he was not comfortable, and more key, not responding to treatment. So he is responding, but obviously in a man of great age, perhaps that response is a little bit slower than what it would have been in perhaps a younger body. So he's responding, he's comfortable. Prince Edward seems fairly positive. They've been passing on messages of support. Prince Charles obviously went to visit. Prince William is obviously being kept really, really well informed as well. And I think basically Philip is in the right place. He's in the right place to get all the kind of medical treatment and help and support that he needs to get back to full health. Mason says, I'm so glad he recovered. Well, I still wouldn't say recovery. He's still being treated. He's still undergoing treatment. So let's not go before the horse has bolted, so to speak. H. London says, so much is going on with the royal family. I wish them the best. Yes, it's been a very busy couple of weeks, and I'm sure kind of any family pressures and stresses are not, particularly welcome at the moment. So anything else that's going on in the royal circus, so to speak, is probably not welcome. I'm just hoping that the Duke is just literally recuperating and getting that strength to get better. Mrs. Maggie Smith says it's wicked the way Prince Charles is getting grief for visiting his father, obviously not understanding the rules. People are not aware, but if you go and watch my other video that I made about this, I put all the legal information into links in the description. People in the UK have been able to visit hospitals, relatives in hospital, since October 2020. It was little publicised when the rules changed, but it is up to the discretion of the hospital that you are visiting. And seeing as most people have family members that are in National Health Service hospitals, bearing in mind Philip is in a private hospital, National Health Service hospitals are naturally a lot busier with COVID. So as hospitals can accept visitations as long as they can be COVID secure, it's up to the hospital to make that decision. So if people have been turned away from visiting, it's probably because that hospital can't be COVID secure. If you're in a private hospital, if you're paying money to be in a private hospital, it's more spacious. They are probably better equipped to be COVID secure, which is why visitations probably are typically going on a lot more in private hospitals than National Health Service hospitals, shall we say. Elaine says, I think he will get his 100th birthday card from the Queen. I think so too. I think we're not out of the woods. Obviously, he's still in hospital. He's still undergoing treatment. But it doesn't now seem as serious as what we were thinking when Prince Charles went to visit during a pandemic. Perhaps Prince Charles was going to visit for other reasons. We don't know. There's been a lot going on in the family that perhaps Prince Charles and Prince Philip want to talk about in person. Let's not forget that Prince Philip is of that generation where when you talk about serious things, you do it man to man, you do it face to face. Prince Philip probably, although I'm sure he's particularly au fait with technology, he's of that generation where if you've got something difficult to talk about or you've got something to say, you do it face to face. So perhaps there was some kind of family business reason as to why Prince Charles was visiting his father, or it could have just been literally because he wanted to see him, and perhaps Prince Philip really needed a visitor. It might even have been at the advice of the physicians. Maybe they said, look, perhaps he needs a visitor, and obviously Prince Charles went. Interesting, we haven't seen Princess Anne visit, because Princess Anne typically, whenever he's been in the hospital previously, is one of the first to visit. So I think that's why I'm kind of moderating the condition now. I kind of think it's perhaps not as serious as what people were thinking, but we still need to be cautious, and he's still not completely out of the woods yet. But it is key that he is responding to treatment. So lots of people saying get well soon. Obviously, like Prince Edward said, they're passing on messages of support. So we don't know who's reading this. So if you want to go and leave a message of support, your get well wishes, leave them in the comments section below. We don't know who's reading. Maybe Prince Edward will pass them on. I don't know. Lots of people saying bladder infection, I expect, and does bring you down. Yeah, I mean, water infections also in people of a great age can also affect the mind. I've known people who have had water infections, and they've been seeing spiders and cats and things that aren't there. So yeah, I think probably the hospital is the best place to be right now. Yes, he has been vaccinated against COVID. But there's been no suggestion that, in fact, it was actually said that this is not COVID related. So no. Tim says, curious why the Queen has not been able to visit. I think they are just bubbling the Queen. Yes, she's had the vaccine. We don't know whether she's had the second vaccination yet. So I imagine they are just still being very precautious with the Queen. I think she's still in that kind of protective bubble. So any amount of movement for the Queen in terms of travelling will be restricted for the time being. We're doing incredibly well here in the UK in terms of getting people vaccinated. We've already had a roadmap being mapped out by our Prime Minister out. We don't want to do anything that's going to, we're so close, basically, and we don't want to put the Queen at any undue risk. And visiting a hospital where potentially they're treating people with COVID could put her at undue risk. And as long as he's doing well, I think it's probably better that the Queen stays where she is at Windsor. Jerry says, I know why he's in the hospital. He's 99, almost 100. Yeah, and I agree. I think age is a factor. People can fight off infections a lot easier if you're younger, unfortunately. Right, I'm going to skip down to the bottom of the page. Tim says, I heard by June life should be back to normal in the UK. We're hoping. We are seriously hoping. As long as everyone still keeps following the rules and accepts their vaccinations, we should be. IBM says, is Archie and the new Sussex baby going to be given a title like Master? No, because Harry and Meghan have requested that any titles that Archie and new baby could have at the moment, that they're not going to be styled by. Basically, Harry and Meghan have said no titles. But, of course, the birthright remains with Archie and new baby when new baby's born. Once Charles becomes king, they are entitled to be known as HIH and Prince or Princess, obviously depending on new baby's gender. And when they reach the age of 18, they can choose themselves whether they want to take up that birthright or not. Mary, we are all hoping for normal again. Mary's also praying for Princess Anne. No news, we don't have any information about Princess Anne's health, but yes, I think we're just praying for all of the royal family as well. Okay, let's have a look. I'm going to skip down. So that's kind of all to report, really, at the moment. I'm just going to kind of read a little bit of information from a UK report, just to make sure that I haven't missed anything. But yeah, all it's doing is going over exactly what I've said, quoting the Buckingham Palace announcement. By the way, for those of you who are just tuning in, the official announcement says, the Duke of Edinburgh remains at King Edward VII's hospital where he is receiving medical attention for an infection. He is comfortable and responding to treatment, but is not expected to leave hospital for several days. So I don't think we're going to have any further updates about his health until he's out. We may get some kind of, comment, probably not an official announcement, but perhaps a comment released to the press, maybe a press release saying that he has returned to Windsor Castle to be with the Queen. Unless there is, an unfortunate turn of events, I don't think we're going to get anything else, to be quite honest. So that's kind of all that we know. Sonia says, why is it said that Prince Philip is not a king? He's married to the Queen. Because the rules are kind of unfair. So if we had a king, the wife of a king is always a queen consort by law, which is why Camilla, unless they change the law, is a queen consort by definition. But we still have the kind of the laws with the aristocracy and the royal family where a king kind of outranks a queen. So if by marrying the Queen, Prince Philip became a king, it would outrank the Queen, and you can't have that when you've got a queen regnant, a sovereign queen. So therefore, the decision was taken not to make Prince Philip the prince consort like Victoria's consort Albert was. Personally, I don't see why he couldn't have been prince consort. Obviously, prince consort ranks less than a queen. But anyway, I think Philip was happy with being made a British prince, getting the HRH, being a prince of the United Kingdom, and being known as the Duke of Edinburgh as his main title. Right, Francis says, hi all, any infection is serious. It is at that age, but he's getting good treatment. He is indeed. Kelly, I've spoken about titles in lots of different videos, but perhaps I could make one on specifics. Right, I am going to go now because we don't have any other news about this, and I want this video to be literally just pretty much about the Duke of Edinburgh. So, if you've enjoyed the update in terms of getting true and factual information rather than second-hand gossip, which obviously does the rounds on Twitter and Facebook and all the rest of it, then please give this video a big old thumbs up. Also, as I said before, please feel free to leave your messages of support to the Duke in the comment section below. We do not know who is reading them and passing them on. Maybe Philip is sat there in bed with a laptop or an iPad scrolling down. I don't know. I don't think he's that vain. But anyway, you never know if the messages will get there. So I'm just delighted that I'm able to bring you some kind of positive news. In a sea of darkness, I'm able to bring you some kind of light. So, thumbs up, give the video a thumbs up, leave a comment, subscribe, and of course, look out for my future videos because there will be some. So, from me in Shropshire, mwah to you all, and goodbye.